Canine Therapy Corps' animal-assisted therapy programs are an integral part of treatment at healthcare and educational institutions throughout the Chicagoland area. The effect they have on patients and clients of all ages can be seen in just a glimpse at any one of them.
Part of the therapeutic process, no matter what you're doing, is the attachment that child and that family has to the treatment, to the people involved in the treatment, and the belief that they're going to get better. If you have a dog at home, you know that a dog is part of your family. Now take that animal and put them in a therapeutic relationship.
I think Canine Therapy Corps will add a benefit to children with special needs and help to achieve their goals faster than with traditional therapy.
Anna started working with Billy because her therapist, Patty, thought that it would be a good idea for her something a little extra to work hard during her therapies.
I really used Billy to come up with a strategy that's going to help Anna achieve a goal that we need her to do in order to improve her strength right now. I try to put Billy strategically in a place where Anna has to focus on him but do something that's going to strengthen her muscles.
There's definitely a difference between the sessions that Anna has with Billy as compared to the therapy sessions that she has without Billy. Billy really acts as kind of an arm of a therapist. He really does.
As I get her throwing the beanbag, the dog will retrieve the beanbag, bring it back to her. She's moving her arms away from her body and using more of her proximal or trunk muscles. So the dog really achieves that goal for both of us. It helps her become more confident because it puts her body alignment in a better position.
Anna feels like she has some control, which I also think is really important because sometimes kids with disabilities don't have a lot of control. And when she's working with that dog, she does have control.
There's so many things that Anna has to achieve yet that Billy knows how to do. So there's a myriad of things that I can make that dog do for me. I just have to use my creativity and try to fit it in a 50-minute session. So I see that dog really as a treatment tool.
From the results that we're seeing right now, can many children benefit from animal-assisted therapy? Yep, you bet. We see that here on Tuesdays and Wednesdays on a regular basis. Neil is a great example of the benefits of animal-assisted therapy that we've seen here.
I'm working with Neil on getting him to be able to walk better. Neil likes to walk but doesn't like to walk far distances, so we want to make it easier for him to go further and to walk with less assistance to help him out in his day-to-day living skills. Working with Lucky, Neil can stay regulated with his sensory issues. He sometimes doesn't like loud noises or visual things, and when Lucky walks along the side with him, he's able to know that Lucky's there and he feels more secure, and so he's able to block out some of these visual things that might otherwise have bothered him. Lucky and Terry are very helpful when working with Neil because it gives Neil a purpose, something to do while he's walking. So instead of just walking and having no place to go, his purpose is to take Lucky for a walk and to do things that Lucky needs. Lucky definitely adds some extra therapeutic benefit. He definitely changes the role that Neil has from someone who is cared for to someone who's now in a role of caring for someone else. So it's a whole different role for Neil, and I think he enjoys that change. The biggest impact that Lucky has made on Neil, he wants to walk and stands taller. He's able to walk further, and he's really using less and less assistance than he ever needed before.
Pediatric therapists and audiology staff are very grateful to have Canine Therapy Corps provide animal-assisted therapy. The dog handlers and the dogs are well-trained, very compassionate, and they have exceeded our expectations.
The dog gets our therapy done, and it gets it done where the kids enjoy coming to therapy and they are willing to work through the pain, the fatigue of working in therapy. They realize that it's hard work, but they're accomplishing something.
I think of them when they put their vest on. I've heard many of the handlers kind of comment that they know that they have a job to do. So I kind of look at it as that they're a fireman or a policeman. The uniform goes on and they know what their job is.
I mean, these dogs are special people, if you will. This is not an issue where we have a cute little dog who comes in for a one-time visit to a sick patient in the hospital. These dogs come week after week, month after month, and spend time with the children as they go through physical therapy, chemotherapy regimens, different types of treatments.
Thank you to all the Canine Therapy Corps' institutional partners who help us provide our wide range of animal-assisted therapy programs.